Are we good to go, or shall we wait? Okay, good afternoon, Cincinnati. First, I want to thank you. I made a big point of pointing out that there were tens of thousands of you with ballots on your kitchen table. And on Monday and Tuesday alone, there were over 28,000 ballots handed in either in person or by mail. 28,000. And there are many others that are still coming in that are postmarked. And so thank you for listening and for exercising your right to vote. And in particular, I want to take a minute to discuss the importance of Issue 7, which looks like it's going to pass. It hasn't been finally certified yet, but it's looking promising. This is in my opinion, incredible positive development for our community. It will dramatically expand bus service in our county once it becomes safe again to do mass transit, which will help people get to their jobs and to their homes in a more efficient and affordable way. It is the largest investment in public transportation in the history of the county, and it's the first one ever approved by the voters of Hamilton County. I'm very, very proud of that, and that will bring opportunity to more people. In addition, especially those of you who are living on the west side, this ballot initiative by itself will be able to allow us to build and rebuild the Western Hills Viaduct. Yes, that is not a campaign promise. It is now an actual commitment. Assuming this election is certified as a yes vote, the county and the transit authority will have the money, in addition to the $100 million that's already been committed by the city, the county, and the state, to get that completed. This has been a long-standing priority, and we had to take care of it ourselves, meaning we, the taxpayers, who voted for this. The third issue I want to point out about it is, and this I don't think was as well advertised during the campaign, but it's important for you to know, because it's good news, is that you, city taxpayers, city residents, and or people who live in the suburbs that work in the city, you will see an income tax cut. Yes, cut. I know it's hard to believe that a tax levy that expands bus service would simultaneously lower your income taxes, but it does. And in the last 10 years, all the major cities in Ohio have raised their income tax. And we, the city of Cincinnati, by a vote of the people, just voted to lower our tax, which will also, at a big picture level, create opportunity to attract more businesses and corporate headquarters to the city. And so this is one of those things, especially in the coronavirus era, where it's scary. What does this mean? Can I afford this? And I want to thank the voters of Hamilton County for approving it. I think it is going to make a huge difference, positive difference. And for city income taxes, it'll actually be a cut for you and save you money at this difficult economic time. I want to thank Craig Cassee, the chairman of SORTA, Brendan Call, Jared Camrus, Taylor Liggins, Bobby Dillon in my office, Jessica Baker, Greg Landsman, P.G. Sittenfeld, and many, many others who I probably forgot to name. Cam Hardy, who's been a strong advocate for public transit over several years to help get this done. So that's all for now on the election, but I'd like to bring up Health Commissioner Melba Moore for our update today.
Thank you, Mayor Cranley. Good afternoon, Cincinnati. Today, our 3 o'clock report, we have received a total of 28 newly confirmed positive cases. This brings our case count to 477, and 2 of those cases change jurisdiction. The ethnic breakdown, 106 white, 129 black, 197 unknown, 40 other, 2 Asian, 2 Pacific Islander, and 1 refused to answer. We currently have 54 individuals hospitalized, 16 white, 22 black, 1 Pacific Islander, 13 unknown, and 2 other. Unfortunately, we do have 21 deaths today to report. 4 white, 8 black, 9 unknown. We have 159 individuals who have recovered. And that definition for recovered is an individual who has been released from monitoring and the case is closed. 45 white, 47 black, 1 Asian, 57 unknown, 8 other, 1 refused. We have 327 individuals who are currently going through contact tracing. In our health centers, we have 96 individuals who have been tested, 17 are positive, 9 white, 5 black, 2 Asian, 1 unknown, and we have a total of 646 test kits available. Total confirmed cases for the state of Ohio, 17,303, 937 deaths, 3,421 hospitalizations. The median age range is 51 years, and that range covers less than 1 to 106 years. The percentage breakdown is 57 males and 43 females. Thank you.
Thank you, Commissioner Moore. I'm happy to report that Kroger will be implementing drive-through testing this Thursday and Friday at Dunham on the west side, where I spent a lot of time as a kid, and their parking lot at 4356 Dunham Lane. I want to make clear that this testing is not for anyone. In order to receive a test there, so don't just drive in and expect to get a test, you must make an appointment in advance and meet the Center for Disease Control's level 1 through 3 testing guidelines. Aaron Rolfes from Kroger is here to explain how this will work. Welcome, Aaron, and thanks to Kroger for all you're doing.
Thank you. So just walk through a little bit of what you can expect when you start the process. So you can kind of see on the screen here is our initial tool. You'll have your virtual assistant, Barney, who will walk you through all of the information that we need to gather to help you schedule a test. So you answer a couple of questions. The first one will weed out anyone who is experiencing some severe COVID symptoms, so someone we wouldn't want to wait to get a test and who should seek emergency medical attention immediately. And again, if you're experiencing those, the tool will point you in the right direction. From there, it'll talk through some of your symptoms, as well as are you a first responder, things like that, and then lend you to the testing site location. When you arrive, I want to make sure that everyone stays in their car. This is a drive-through testing location. You'll crack your window when an associate tells you to, and you'll receive a swab through the window. It's not the really long swab, the scary one that you've been hearing about. It's a shorter one. And then the nurse practitioners and folks on site will walk you through how to administer the test. They'll watch you do it and make sure that it's done properly. And then you sit it back through the crack in the window and kind of go on your way. After that, our commitment is to contact you back either via our portal or via phone call within 48 hours, and anyone who tests positive will get a call from us in that time period. Very excited to be able to test 500 people over those 2 days, so please go on and start signing up for those. Thank you.
Thank you so much, Aaron, and to Kroger. I would now like to introduce Councilman Greg Landsman, who will talk about an incredible partnership that has been formed between Cincinnati Children's, Kroger's Zero Hunger, Zero Waste Initiative, and 8451 to track and map hunger in our city to help those in need. Councilman Landsman.
Well, thank you, Mayor. The human capacity for compassion and to serve has been on full display during this crisis all over the country, but certainly here in Cincinnati. And this partnership between 8451 and their ability to do amazing analytics, pull a lot of data together, and partners throughout the city, including the Free Store Food Bank, has enabled us to, as the mayor said, map the food distribution sites where we are distributing food and to see where there are gaps. And then to work with our partners to fill those gaps. Umira Savani from my office has been working on a weekly call with over 100 people. Every week, 100 people get on a call. They look at the data with 8451, a great corporate partner, the Free Store Food Bank, others, to say, okay, where are we distributing food now? Where are the folks who need it? And if there is a location or there isn't a location where there are folks that may need to walk, we've been working together to create those locations. And it means that folks are getting the food they need, but also other supplies, equipment, all of the things that folks need right now. And so it's a great example of people coming together, using data, being focused on the folks we serve. And my hope is that this kind of partnership continues long after the crisis is behind us, that we continue to work this way together, using data, focusing on those we serve, and making sure that no one gets left out. Thank you.
Thank you. And did any of you guys want to say anything? Yeah. And introduce yourself, please. Yes.
My name's Charles Hoffman. I work for 8451, which is the data analytics arm of Kroger. So just to kind of highlight from the data side of this project some of what we did, it really exemplifies Kroger's Zero Hunger, Zero Waste initiative, as we talked about, and also, Greg, what you talked about, the importance of the partnership that we established before this between 8451, Cincinnati Children's, and the city of Cincinnati, which has really enabled the rapid movement to solve some of the issues around food distribution within the city of Cincinnati. So our goal was to identify gaps in the coverage, specifically focused on impoverished children within the city of Cincinnati, to ensure that families generally didn't have to go more than a mile to access free food distribution sites within the city of Cincinnati. So between 8451 and Children's, we iterated on a few different ways to look at that, and then through Councilman Landsman's office, they were able to organize all of the different stakeholders, and now we have that weekly meeting of about 100 stakeholders where we're really able to provide the data and insights for them to action. And just to highlight some of the actions that have been taken on that, we have amazing partners in this community across the food distribution network, to include Cincinnati Public Schools, Free Store Food Bank, UMC Food Ministries, La Soup, and various others who really took hold of this data and made amazing improvements to the food distribution network within the city that have allowed thousands more families, and especially children, to access free food distribution sites. Just to highlight two of those, within Villages of Roll Hill, a site was opened in response to these meetings that we've had, and by the second day, that was serving over 1,000 meals, and it's open 2 days a week to that area. And also to highlight the efforts of the Free Store Food Bank, they're setting up some emergency food distribution sites. The site that they opened at Elder yesterday for a one-time distribution served over 1,000 emergency meal boxes, which is the equivalent to almost 23,000 meals, and that was just in one day. So really the amount that this partnership has been able to increase the food distribution within Cincinnati is something that we're really proud of at 8451. So one more thing to highlight, just all of the effort that the different stakeholders in this have done. We want to make sure that the public has access to it. So at 8451, we've also created a website that is showing on the screen that highlights the different food distribution sites within the city of Cincinnati. There's a video tutorial that will be along with the press release that can guide you on exactly how to use that resource on the map, and then there's also other resources within the website that can point you to other food distribution resources and other Cincinnati and COVID-related resources. So thank you very much.
Hi, I'm Robert Kahn. I help oversee community population health as a pediatrician at Cincinnati Children's. And Cincinnati Children's aspiration has been to help ensure that every child can thrive. But often what really drives child health are threats like food insecurity, eviction, and exposure to violence. And those threats loom particularly large at times like these. And these kinds of wicked problems require that we all lean in, right? The city, public health, education, healthcare, businesses, and families themselves to build effective and trusted solutions. And so in this effort to prevent hunger, it's really been an amazing collaboration between city leaders like Councilor Landsman, 8451, and the community food providers. So Cincinnati Children's has been really pleased to bring a couple things. One is our deep commitment to child and family well-being. A second, a real focus on outcomes and data-driven solutions in trying to reach all vulnerable kids. Third, methods to help ensure the whole system comes together to learn and improve every day. And last, trying to help lift up the voices and capabilities of families to help create solutions that work. So I'd like to note today that while we're talking about hunger, we're already seeking to build on this work. So how can we protect the health of families, including face masks and sanitizer, and ensure that all families have access to trusted health information and health services as they evolve and emerge over the course of the epidemic, the mobile clinic being a really exciting example of it. So I'd like to thank 8451 for the partnership, the leadership in the city for bringing us together, and a particular shout out to Dr. Carly Riley, Dr. Allison Parsons, and the whole Cincinnati Children's team who have literally been boots on the ground, having started the mapping effort and then making sure we're learning every day how to get better. So thank you very much, everyone.
Very inspirational. What a collaboration. Thank you, Councilman Landsman. Thank you, Children's. Thank you, 8451. Really, really good stuff. One Waterworks public service announcement, especially for those of you who are reopening a business that was closed for weeks or months. It's important to flush your water. The water is safe. But if you turn it off for a long period of time, bacteria can build up. And so Waterworks is recommending flushing sinks, faucets, showers, tubs, and all plumbing for a period of time from all faucets on all floors at the same time. And I promise your dad won't be mad at you in this particular case. And that will keep everybody safe. And last but not least, in light of what you just heard, it's a great time to give the Free Store Food Bank. So please consider doing that and consider giving to the United Way Greater Cincinnati Foundation Fund by texting RAPID to 91999. All right, looks like we don't have a lot of questions today, but let's start with Channel 9, WCPO.
Hi, Mayor. This is Kristen Tully with WCPO. Apologize for a bit of a gear shift, but do want to ask a serious question regarding the deficit that we're facing and wanting to know if, as many people suggest, the possibility of filing for bankruptcy, if that's something the city would ever consider.
No, well, I think the short answer is no, but obviously the budget presentation today was very serious. The Brookings Institution, a very respected think tank, has identified Cincinnati as the #2 city in America most at risk to see income collapse because of our reliance on the earnings tax. #1 is Columbus, Ohio. And 4 of the top 5 are Ohio cities. This is why we've worked so hard with our congressional delegation to ask for the flexibility to get through this crisis. It seems likely that there will be a dramatic drop for 1 year and then some kind of a rebound. Now, it may not rebound to where we were in February, but it'll rebound, probably not the kind of drastic short-term cut that we're going to face with $91 million deficit. So if the $91 million is a one-time, one-year event out of a 100-year pandemic, but the following year, maybe we're dealing with a recession, and so maybe we're down 10, 15% instead of being down 25%. we have to make sure we're on a path that gets us to a structurally balanced budget in 2 years. But in the short term, we are taking aggressive action to bring back money that we had sent out from the city. We have obviously done the 1,700 furloughs, which are now a smaller number because we just brought back public health workers, et cetera. So we will be taking a number of actions to cut costs, but we will hopefully receive assistance, as been promised to us by our congressional delegation, because it is a one-time event. The bankruptcy comments, of course, have sprung from Senator Mitch McConnell's comments from Kentucky. And I just want to reiterate what I said the other day, is that it's, what a hypocrite. A guy who prints money lecturing us about balancing our budgets with massive shortfalls. I mean, the nerve to make that statement that we've been irresponsible when, unlike him, who has overseen the largest deficit spending in the history of this country, we balance our budgets every year. And so I was heartened to see that our senators, Democratic and Republican, Portman and Brown, as well as our local Republican congressmen, have all stated that they believe that making sure that police and firefighters, for example, are not laid off in the middle of a pandemic when public safety is more important, and we've seen an increase in shootings. So I don't know if that answers your question or not, but I think it does a little bit. Any other questions?
Yes, I have one. Sorry. This is Helena with WLWT. We were experiencing some technical difficulties before, so forgive me if you kind of touched on this at all when you were going through the new numbers. But on Cincy Insights, which is very helpful, I do see that there's about 91 confirmed cases in the Westwood area, which seems to be just a lot more in that consolidated area than we're seeing in surrounding areas. Is there anything that could be said about that? Why that is?
What I can't really say why, but a couple of things come to my mind. We want to make sure that people in that area and across Cincinnati are practicing social distancing, and when they're out, wear the mask and really monitor your symptoms. What are you experiencing? And please call us. Call your local health department or your primary care provider to report what you're feeling. It could be clustering in that area, and individuals did get tested, and we're seeing that high number, and it could be they were exposed. So it could be a number of variables that are going on in that area. Thank you.
I don't want to minimize it. It is our largest neighborhood, so it's not surprising that it would have the most number of cases, but that doesn't make it something we're not worried about. Any other questions? All right. Well, not as pretty as it was the last couple of days, but be safe, take care of yourself and your family, and I'll see you on Friday.